Welcome to today's People to People. I'm Micah Mater. It is no surprise this time of year there are a lot of germs floating around, with folks coming out from their holiday celebrations and immunizations waning. There's an increase in respiratory infections and flu, but fear not, the doctor is in. Physician, author, and international healthcare consultant Dr. Jeffrey Sterling is here. Hello, Dr. Sterling.
Hello,
How are
and
you?
Happy New Year.
Happy New Year to you too. Great to have you. This is a really good time because kids are going back to school, so they're getting all, hanging out with the other kids and this, that, and the other. And norovirus is really, which is the stomach flu, pretty much. How do we avoid that?
You wash your hands.
Oh, simple as that.
Most of the things that we've talked about will continue to be simple, and we do ourselves a disservice when we try to complicate it. This is really basic hygiene. If you wash your hands when you go into a room, when you come out of a room, after you eat, and especially when you're coming from the bathroom, that's how it gets done. So, there's a chapter in a book that I wrote a long time ago called "This is Why Doctors Don't Shake Your Hands."
Oh.
It's that type of principle. If you engage in pretty much simple hygiene, wash your hands for 20 seconds with soap, and these days we're using sanitizer, that goes a long way toward reducing the risk for norovirus and other pathogens to cause diarrhea.
But didn't we learn this during the pandemic? I mean, everyone had hand sanitizer, and we were washing and avoid handshaking. Now we forgot?
Yes. We forgot. And there's another great book that says that you have to hear things about 1,500 times before you really incorporate them. So for the next 1,500 days, if people would just focus on washing their hands and making sure that they're not touching other people who may not be as clean as they would want them to be.
Yeah.
Okay, squirt in, squirt out is what we kind of say in the emergency department.
Okay, we talked about the pandemic when we were all wearing masks, but a lot of people are saying wear masks again because RSV is high, respiratory infections are high. Why now?
Why not now? It's actually, 20 years ago, I was always impressed when I would travel internationally and you would see people with masks and you didn't really appreciate what that was about.
You thought that was weird.
You thought it was weird. But the truth of the matter is that unless you're maintaining 6 feet of distance, the next best thing you can actually do is to have a mask, because it protects what's inside of you from being propelled out onto someone else. And just to prove that point further, the rates of asthma exacerbations and of influenza during the pandemic dramatically plummeted. And that wasn't because the disease wasn't trying to get you, it's because you were protecting yourself from COVID, and as a byproduct, the other types of things also got some degree of protection.
Are the numbers going up now?
For what?
For influenza, for COVID and things like that, because we're not wearing...
Well, first of all, we're in respiratory season, so yes, it's going up, but on an absolute scale, last year the CDC actually said that there are about between 45 and 50,000 people who died both from COVID and the flu. These are chronic diseases that show up every year. The flu's been around literally for 100 years, killing 35 to 45,000 people a year. They're both in the top 15 causes of death. They're there. We just kind of become immune to the idea that they're still there killing people.
No pun intended. Alcohol and cancer, that's all we're talking about now. If you drink alcohol, you're going to get cancer. But didn't we know this already? Why now is this a big deal? We've had alcohol for years.
Yes.
Decades.
We've known it, but we're just now being prompted to pay attention to it because the government has finally gotten around to doing what the physician community has been suggesting for decades now. Alcohol is toxic. You know that based on how it tastes when it goes down the back of your throat, if it's tasting scotch anyway, or some other hard liquor.
So some of it tastes good.
It's carcinogen. This thing has literally just now been classified along with alcohol and asbestos as level 1 carcinogens. It causes cancers of the lips, the mouth, the throat, the colon, breast cancer, and of course your liver, and another part of the intestines as well. This, because of the way that it breaks down and the way that it breaks your skin down, makes the development of cancer cells easier.
This is scary, doctor.
Well, cancer is scary. It's always been scary, but these tips are information that we can use to be empowered, and that's the point of the matter. And it's not that you're just going to drink one drink and develop cancer, but you need to have this knowledge so that you can engage in risk reduction if you're inclined to do so.
What about red dye number 3? That's another one. Like, let's stop that. And I remember hearing about this as a child, saying that the cancer, it causes cancer in rats. But now all of a sudden, don't eat it, take it out of the food.
There's a lot of foods that are about to be affected by that.
Yeah, a lot of junk foods.
A lot of junk foods, your favorite colored beverages, a lot of your favorite candies and cakes, very much so. These are chemicals. What do we think was going to happen?
But why didn't they take it out before? Can somebody be to blame for this?
You have to consider where we are. Lobbies are a real thing, interests are real things, and we are in a democracy and a capitalist society, so facts, it's kind of the difference between public health and public policy. Public health is always trying to do what's in the best interest of your health, but we are in a state that's dictated by good health. You know, the people have to decide in the name of freedom what they do want to partake in at their own risk and what things that don't.
Just
need
eat
to be
whole
partaken in.
foods. That's the best way to do it, right?
If it's coming from the ground, it's a good thing.
Right, okay. You know, I heard a little birdie told me that it's your birthday
Yesterday.
but we're going to say it's today. Happy birthday, 61.
Oh,
You don't
God,
look a year over 45. We've got a little surprise for you.
Oh, well, looky there.
A big, juicy cake. What do you think? Is this good to eat?
Well,
There's no red dye number 3 in there, is there?
I'm looking at the caramel corn.
Yeah,
but,
right. Is that good to eat?
Well, again, everything in moderation.
Moderation. I was going to say moderation, right?
But my personal, I do 4 desserts a month.
Thank you so much.
Thank you. I do 4 desserts per month, and when I decide to have dessert, I go
You
all
go
in.
all the way. Well,
It's
this will be
quality of
4,
life.
4 or
Thank you.
5 or 6 this
Oh, my
month, I
goodness.
think.
I
Happy
need friends to
birthday.
share. Thank you so much.
Thank you so much. Up next, if you're new. Oh, look at. Oh, isn't that cute? Happy birthday to you. I can't sing, but I would if I could. Up next, if your New Year's resolutions included getting fit, don't eat this cake. Our next guest says making the connection between body and mind can lead to big changes that will benefit you for a lifetime.